Hi, everyone. I'm Frank Malakote. I'm an anchor and a reporter for Fox's KTVU, Fox 2 in the San Francisco Bay Area. To date, there have been 76,000 deaths, all due to the coronavirus. What that does not account for is some of the collateral damage because of the virus, the deaths caused by more alcohol use, more drug use, and sadly, suicide that is directly linked because of the stress of the virus itself. My guest will shed a little light on that. Dr. Ben Miller is the Chief Strategy Officer for Wellbeing and Trust, and Dr. Jack Westfall, the Director of the Robert Graham Center. Gentlemen, welcome. Good to have you with us.
Thanks, Frank.
Good to be here.
Dr. Miller, why don't we start with you? Tell us what Wellbeing and Trust is all about.
Sure. Wellbeing Trust is a national foundation committed to advancing the mental, social, and spiritual health of the nation. We're actually in your backyard in Oakland. So we were founded by Providence St. Joseph Health System, really with a national mission to go out and change the way that the nation is pursuing mental health. Part of that means we get to work with great people like Dr. Jack here.
All right. And Dr. Jack, it's your turn now. The Robert Graham Center. Tell us about
that. So the Robert Graham Center for Policy Research in Primary Care and Family Medicine is the policy development arm of the American Academy of Family Physicians. We work with the Academy and with other primary care organizations to create and curate policies and evidence that support primary care, specifically integrated primary care with behavioral health.
All right. So you two doctors, two groups collaborated on this study called Death by Despair and concluded that 75,000 plus will likely die, not from the virus, but because of the virus and some of the stress related to that. Dr. Miller, tell us why.
So Frank, deaths of despair is actually not a new idea. Coronavirus did not shed this new light on deaths of despair. They've been here for several decades now. And what we know is the last recession, 2008, deaths of despair started to rise exponentially. Deaths of despair, as we describe it, is deaths due to drug, alcohol, and suicide, very consistent with the literature. And so we started talking to each other, Jack and I, we're like, what will happen when a pandemic overlays an epidemic? Will this lead to increased deaths of despair? Will we see more deaths to drug, alcohol, and suicide? What would that look like? And how can we make some predictions? And so we got with some analysts and some researchers, and we started to look at those data. And the trends, as you described so eloquently, could be really bad. You know, we could lose a few more additional deaths of despair, or we could use a whole lot more. And what we like to say is that all of these are projections, and that we can actually prevent these from happening if we take the right things, if we do the right things and make the right decisions.
And Dr. Westfall, can you shed a little light? How do you do this study?
Yeah, so we utilized a couple of different components for our modeling. First, we used historic data on deaths of despair related to a previous recession, specifically the recession from the 2008 recession. And we saw from that an increase in deaths of despair related to unemployment and the economic downturn. And so we utilized the data from that historical experience and projected those deaths. Now, we're not sure what the recovery for coronavirus is going to be. So we made three projections. One that looks like about the same time frame for recovery. However, because the unemployment is going up so quickly this time, and we have the history of knowing what happened last time, we may be able to intervene once this the acute phase is over and we're back into recovery to do some economic stimulus that would shorten the length of time for recovery, decreasing those number of deaths. The second component of that is really this concept of isolation and disconnection. And so there's really not been research on groups of people disconnected and isolated. We know from the research that an individual who is suffering from social isolation has a higher rate of mental illness, suicide, alcohol, and drug use. When we think about that across the entire 330 million people in America who are trying to physically distance, we consider that as another risk factor for additional deaths of despair.
So the whole idea that this virus, unlike in 08, 09, when we had the downturn in the economy, there's no end to it. And the fact that we have this uncertainty, your data may skew up much higher, right?
Yeah, that's right. And I think, though, it gives us an opportunity, Frank, to talk about some of those issues that our nation has been refusing to address, issues around mental health and addiction. So
Sure.
it doesn't take us, long to go back and look at the fact that, over the last several years, people have had a harder time being able to get access to care. Mental health services are one of the most important services that we could have on the front lines, just like primary care. And we've made it so challenging and almost overly burdensome on individuals to get access to that care. So it's not a surprise that we've seen an uptick in some of the deaths of despair. What is a surprise, though, is that our nation hasn't really done much about it. And we hope that this study is one way for us to begin to have a different conversation on what excellence could look like for mental health in the nation. Without that, we are afraid that the data could look quite bad. And we could see some of those deaths continue to rise, but it doesn't have to be that way.
What kind of reaction have you gotten from the study?
So I think people have been quite taken aback by this prediction of deaths of despair and 75,000 deaths of despair. I think when people think of suicide and drug and alcohol abuse, it's usually those people out there. And what this brings home is that this is going to affect all of America across all socioeconomics and geographies. We do believe that probably communities of lower socioeconomic status, people who are more at risk of unemployment may have a disproportionate share of this. But we've gotten a lot of positive feedback as well of what can we do about this. So we want to make sure that there is a strong message that this is not the destiny of our country. This is a wake up that can say, we can do something about this so that we can prevent some of these deaths.
Before I interviewed both of you, I was thinking, it never really were so circled in on the coronavirus. You kind of forget about those that, are kind of on the edge already. You take away their job. Some are homeless. Some are already depressed. And you throw this layer of ugliness over them, and it could very well push them over the edge. Dr. Miller, what do we need to do? What do we need to do to lower this number in the weeks, months, and years to come?
One thing that's clear from the data and from our study is that employment does matter. And I think this is where we can lean into the creative ingenuity, entrepreneurial spirit of this nation to create new and novel ways to give people employment opportunities. That's got to be, whether that be through contact tracing, getting people out there, whether it be some type of private business that creates a new mechanism to allow employees to work from home. Whatever it is, we have to pursue that. That's number one. Number two, we got to get people connected. Jack and I have talked a lot about this. We know that social isolation and loneliness can be as bad for you as many other chronic diseases, obesity, smoking, the data. And so how do we get people connected in a time of being disconnected? Well, I'll tell you just really quick anecdote here. Today, I was on a phone call and I heard honking outside of my window. And literally today, a couple hours ago, I went out there and there was a bus of school teachers all wearing protective gear, masks, distancing themselves, going over to see a child across the street and just having signs standing in the yard, waving and yelling for them. That is an opportunity of how we can be connected. Small things like that go a long way. And last, and I'm sure Jack's got other ideas here, we got to give people good care. As I already mentioned, mental health has been fragmented for far too long. It's an opportunity for us to really be considering what hasn't worked as a nation in addressing mental health and addiction. So we can use this moment, like many of us, as an opportunity for reflection. Let's look at things that weren't working before that we could fix now, that when we're done with this, can ultimately provide for those folks out there who have mental health needs.
In the news biz, we've run a lot of stories of, you see hands on windows for, your parent might be in a senior care home or something like that. And it just, it warms your heart. And then of course the drive-bys for kids that are graduating or having birthdays. We are social creatures, that's for sure. Jack, why don't you jump in and give us your thoughts as well?
So, Frank, I'd like to add just a couple things to what Dr. Ben said. First, I think integrating primary care and family medicine and medical. Sorry, can I start over on that one?
You sure can.
Absolutely.
I'm
so glad we're taping. So, Frank, I'd like to add a couple of things. I think the first is integrated primary care and mental health is crucial. And a lot of primary care providers and family doctors are integrating psychologists and counselors into their practice so that it's not mental health and medical health. It's all of our health. And so getting rid of the stigma related to mental illness is crucial to this. And I think it's important for us to consider as we think about supporting primary care practices and medical practices, how are they integrating behavioral health, mental health into those practices? The second part is there's this new workforce of COVID-19 trackers and tracers that are going to be identifying people who have the infection or are at risk of the infection or who have been exposed to the infection. And that's a new workforce of 100,000 people possibly being hired to collect data on COVID-19 infection. That group is perfectly poised to also identify people at risk of suicide, alcohol, and drug abuse. And so we're recommending some sort of training for that workforce so that it's also a COVID-19 mental health tracking and tracing workforce to identify people, screen, get them into the care that they might need.
Yeah. On a smaller note, I have tried just personally to pick up the phone, call people, especially older folks that might be a little isolated, or an old friend you haven't talked to in a long time. And I try to hit one up each day, even if it's just a simple text. If that comes across your phone and you're feeling kind of blue, it can really lift your spirits. That's for sure.
So Frank, I'd like to just add into that. This is one of those components of policy that people often don't think about in terms of local communities creating solutions that can help them connect. So for instance, the Rotary Club or the Lions Club or the faith community, learning how to connect via Zoom or phone or video or virtual platform is going to be really important. However, some of our rural and vulnerable communities may not have the internet or the bandwidth to be able to sustain and support video streaming. And so policies that help support community bandwidth, community internet, and technical assistance to help clubs and organizations and communities actually do virtual connection will be really important as well.
You can also write a letter. They can hold that and read it. You remember those, for crying out loud. My dad has passed away 15 years ago. He'd be in his late 90s, but I lived in New England for 27 years, and I talked to him almost every day. But when I would write a letter and they could hold it, and after they passed, a lot of the letters they kept. So that goes a long way as well. Dr. Miller, why don't we get back to you and just ask you if there's some people out there that are feeling a little blue, a little depressed. What advice would you give to them right now during this, unprecedented time?
Well, it's hard not to feel a little blue and depressed in such times of uncertainty. I think that what I would say to folks is there's two things that we can really do right now. One is the most obvious, which sometimes the information overload is a bit much. Turning off the TV, turning off the radio, closing your laptop, sitting with a book, looking out the window, doing something that allows you to get away from the constant barrage of information, I think does help us relax a little bit more. That's number one. Number two, and probably one of the arguably most important things, is that we've got to check in with one another. So if you are feeling a little down, it's okay to tell someone that you are feeling down. It's okay to not be okay. And it's okay if you're the person on the receiving end of your friend saying that they're not okay, for you to say that you don't know what to do, because being there, listening, being supportive, kind, all of those things go a long way. As we say, the oldest form of medicine is the most powerful, and that's love. And so right now, we as a nation have got to embrace each other and make those caring connections.
Yeah. Jack, how about your reaction to that?
I endorse all of those. And I think I would just add that for people who are feeling on the edge, calling their primary care provider or their behavioral health provider, if they have one, is a crucial next step. So certainly connecting to their neighbors and their family and friends in ways that they can. But if they're feeling overwhelmed, call their primary care provider, call their family doctor, call their counselor to get help.
Yeah. Ben, you're in Tennessee. We haven't heard much about the state. Tell us how things are there, and how are you coping with your family locked up there in Tennessee?
Well, full disclosure, I haven't lived in Tennessee in over 25 years. So I'm only back here in 3 weeks, and I haven't actually met many people because we're all in our homes. So I came from Colorado. I could tell you a whole lot more about Colorado. But what I can say coming from Colorado to Tennessee is that it does appear that there's some, differences in how different, communities are approaching the seriousness of this virus. And I don't want to pass judgment on folks, but I've seen a lot of people that are just out there as if life is usual, more in the South than I did in Colorado. Colorado, at least folks were wearing masks and out there, and I don't want to compare cultures, but it does seem like because there has not been as much of the COVID cases in the Southeast, that people are seeing it as serious as we did in Colorado. So I think that's one thing that I've observed. The second thing, which is a little bit more of a policy note, is that we're watching both Tennessee and Colorado and many other states have really robust debates about when is it okay to open. And because our governments, frankly, are hemorrhaging dollars and are cutting programs left and right. Medicaid, which is the essential lifeline for providing so many mental health services in our nation, is getting cut left and right. And so I know our governors are up against determining when is it most safe and effective to open up versus what programs are we going to cut because we're not opened up. And I think that's a tension that's felt everywhere, not just in the South, but also all over the country.
I would say so. What's it like in Tennessee? Are restaurants open, or is it still pretty well shut down?
It's still pretty well shut down. I think there's a slow opening that's about to come, despite some of the recommendations. I don't think that Tennessee has peaked yet. I don't think any place has peaked yet per se. But what we're looking at is that we found a lot of drive-throughs that are open. Unfortunately, what happened in Southeast Tennessee, where I'm located, is a tornado came through and caused a whole bunch of damage while we were trying to figure out how we were going to shelter in place. So I think that only exacerbated some of the, again, the uncertainty that we've already discussed today.
Sadly, life goes on. Mother Nature doesn't know anything about COVID-19. Jack, how about your thoughts? How was your family coping? I know you're here in the Bay Area, down in the South Bay.
Frank, yeah, so we came out to, we live in Washington, D.C., but we came out here for spring break in March, and Santa Clara County then shut down. Dr. Sarah Cody was very early on in adopting stay-at-home orders. So we have stayed here, sheltering in place. We live with my in-laws, who are an elderly couple, and we're providing them care. One of my students, one of my sons is here. I've told folks and chatted with Ben, it's easier to homeschool a graduate student than an elementary student. So we're having, it's a little easier there, but we are taking walks in the garden, and I've got my green thumb back, but we're trying to really do what's necessary, sheltering in place as a responsibility for our community. This is what we can do for the other people. I know that no one in my family has COVID right now. I could easily go out and not infect people, but it's my responsibility to wear a mask, to stay home, to do those things so that I'm helping the rest of the community live a happy, healthy life. And I think, Ben talked about love, and I love my family and I love the Bay Area. And I think it's really important for us to think about, how do we do this difficult work while still maintaining some connection?
You brought up a really good point, Jack, the fact that when you wear a mask, it's not so much you protecting yourself, but you're protecting others, because they don't know where you've been and who you are. And sadly, a lot of this is non-symptomatic, so you may have it and not know it. So your best bet, if we all wear a mask, is just good medicine for all. Let's get back to you, Ben, real quick. If people want to get in touch with well-being and trust, how do they do that?
Well, sure. They can go to wellbeingtrust.org, and they can see not only this report, but a variety of reports that we've done over the years that talk about deaths of despair and solutions to mental health in this nation. I would also encourage folks that are really more interested in the policy domain, outside of looking at Jack's website at the Graham Center, to also look at healingthenation.wellbeingtrust.org, which is a list of federal policy recommendations that we curated across multiple organizations with the evidence in mind to really advance mental health and addiction in this nation. So that's where I would start.
All right, very good. And Dr. Westfall, the Robert Graham Center, if folks want more information about that, where do they go?
Yeah, so Google the Robert Graham Center and find us, look us up, contact us. We have a contact page. We'd love to hear from people. We do have our work has shifted to about 75% COVID-related work. We're doing a large series of studies right now on telehealth and what is appropriate for telehealth, whether it's audio or video, So we're doing a large number of studies on that. We're also looking at what are the social determinants of health and how do inequities in healthcare lead to inequities in COVID response and recovery. Would love to have people contact us and communicate with us.
Well, very good. Well, it is indeed a brave new world. Thanks for shedding a little light and sharing some of your personal stories. Dr. Ben Miller, Dr. Jack Westfall, want to say thank you very much, gentlemen.
Thank you very much, Frank.
Good to have you with us. I'm Frank Malakote here in the San Francisco Bay Area. For more information, you can always go to coronavirusnow.com.